Absolutely. We have to be flexible with ourselves. We have to take care of ourselves. So finding those things that really bring you joy, that you enjoy, that are safe for you to do. So just really kind of thinking about all of those things, but definitely taking time every day to be able to do just a small bit for yourself for self-care.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative, and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth and smooth is fast. Because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
This is the Mid-America PTTC podcast. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. This is episode 32, and today we'll be talking with Crystal Fuller. Well, Crystal provides training, technical assistance, funding administration, and just overall helping prevention spread throughout her region in Nebraska. She has over 13 years working in prevention and is going to share some insights on how to get out into the community in this new virtual world. And we also get into the importance of self-care in days filled with Zoom after Zoom after Zoom meeting. But before we get into the content, we'd like to thank our funder, Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's episode. All right, I would like to welcome Crystal to the podcast. Crystal, thanks for joining us.
Hey, hi Dave. Thanks for having me.
Yes, it's been a while since we've chatted. Not really, right?
We've seen each other a lot.
Yeah, so it's been great having you and the Nebraska team in our virtual labs. It's been a lot of fun. I feel like I've gotten to see everybody more than before COVID hit. Mm-hmm. It's great. We're getting to know each other even more.
Yeah, taking down borders, right? Taking down that barrier of travel and things like that.
That's right. That's right. And this kind of leads into what we're going to talk about today. Before we get into the rich content and those insights you're going to share, for those that might not be familiar with you, could you share a little bit about sort of your background when it comes to prevention, and also what is your role in Region 6?
Sure. Crystal Fuller is my name. I've been working for Region 6 Behavioral Healthcare for just about 13 years. My professional roles have been with Region 6. So I came out of a master's program in criminal justice. So really kind of just fell in love with prevention and kind of seeing it at the front end of the criminal justice system. I'd always said that I wanted to work in jails and prisons in the correction system. And it just kind of fit better for me on the prevention side of the work. Came out of master's program, came to Region 6 and was in a position called resource coordinator, where I helped work with evaluation, strategic planning, really helped our coalitions be more effective in their work in the communities. So did that for about 4 years and then transitioned to the manager role. Overseeing all of our different prevention work, all of our funding. So I have a pretty diverse role. Our kind of primary role is funding administration. So all of the different state grants that come, the federal grants that get kind of rolled down from the state to the regions to the community kind of funnel through me for prevention. So funding administration, but also technical assistance and coordination in the community to really kind of spread prevention and kind of bring prevention to the table in a lot of different areas. And then training. So over the last 6 or 7 years, we've been able to implement mental health first aid and QPR. So I've been training that quite a bit. So really have a diverse role. And then there's also opportunities where we get, especially in our suicide prevention work, of being out in the community and providing kind of resources for means restriction. So being out in the community, having resource tables at a variety of different places, grocery stores, parent-teacher conferences, those kinds of things, to get those resources into the hands. So a real diverse role that I play.
I love the getting out in the community. Now I hear a lot of different aspects of the training and TA aspect, and then you mentioned, helping prevention spread.
Mm-hmm.
Before folks went into quarantine and isolation, what did that normally look like? I mean, you kind of hinted at parent-teacher conferences and tabling. What else did you used to do before we had to work from home or remote?
We actually be able to be in the community, physically at places where people were gathering, high traffic areas. We have a really great connection with Hy-Vee, so we would have booths every couple months at Hy-Vee to be able out in the community, but just physically being present, going to meetings that you learn about you've never been to, being able to just kind of pop in and so being able to physically be in the community.
How has that shifted now?
So we have shifted to all remote work. So no one is in the office at Region 6 besides kind of those essential staff. So everyone's doing things remotely. And so all meetings that we have are kind of done via Zoom or other platforms like that. We've had to kind of postpone and cancel many of our trainings because unfortunately the curriculums have not been approved for virtual work. And, like mental health first aid, there's a lot of information that's discussed in that course that, you want to be able to process with individuals. You want to be able to kind of identify if they have additional questions or if they're struggling a little bit. So they are revising curriculum to be able to do it in a virtual platform. So, some of those things that we used to bring a lot of people together for trainings just hasn't been able to happen. Fortunately, we've had some of our the trainings that we bring in for our coalitions and our community members have been able to go to kind of an online platform, but really the ones that we do as a region have kind of been postponed.
I feel you there. We've had to make some changes in our training plan and delivery. But I'm interested about your coalitions that have moved some of the stuff into the virtual space. What does that look like, and how's that engagement going for everyone?
So this has actually been really, really good. So we've had some very flexible, creative staff in our coalitions. One of our coalitions has been making videos that are kind of supplemental to some of their evidence-based programs. So they've been recording those and putting them out on YouTube and Facebook and just really getting them to different populations. So just kind of pivoting and having some of that, maybe not the explicit curriculum, but other things that supplement the lessons and things that they have been able to do. And one of our other coalitions has been working with senior care facilities in a program called WISE, Wellness Initiative for Senior Education, and they kind of had to stop for a bit, but they were able to get some technology donated, some laptops donated so that they could give them to the care facilities so they could still have those kind of Zoom meetings to finish out the curriculum. So there's just been awesome ways that they've been able to use technology, and they've been putting their coalition meetings all on Zoom, and we've seen an increase in engagement in all of the different coalition meetings, and having people who may not have been able to meet that time frame with drive time across town, or it just didn't work over their lunch hour or whenever it was. So it feels like maybe people can just hop on a call for an hour more easily than kind of being able to drive that distance or those other barriers that they may have had.
That's inspiring, hearing about the coalitions that are remaneuvering and adjusting to still be able to get out and support the community. I'm curious. I know we have a lot of listeners that sort of work in a similar role as yourself. How are you and your team adjusting and using technology in this virtual space now?
So we've been able to have the opportunity to have a lot of professional development time, and many of those opportunities, kind of helped through the PTTC to be able to have good engagement in a virtual world and learning those new skills. So they've been taking part in lots of those different trainings, but we still have our weekly team connector. And we process through those things. So we just, it's been awesome to be able to bring up our shared files and kind of work on things. So still doing our check-ins, still doing those things. And my staff are connecting with the coalitions on a regular basis. There's lots of different online and Zoom calls and things that they're still doing to connect to make sure that we have good, effective work in our community.
Great feedback to hear. I love that y'all are using the virtual lab tools and skills that we've been covering. That was something that we partnered with Hugh Life on to get put together quickly because the field needed it.
Mm-hmm.
And so it's always delightful to hear such good feedback. You spurred a thought. You mentioned your weekly check-ins with your team. So I was just on the Kansas Prevention Talks podcast, and we talked about self-care and routine and that we got to take care of ourselves more so now than if ever. And it sounds like y'all are doing some work there too. What would you sort of share along that same concept of self-care for the professionals?
Oh my gosh, Zoom is exhausting.
Tell me about it.
For people that, spend a lot of time on those online meetings. And I read an article that was talking about why are these meetings so exhausting versus in-person meetings. And it's like, well, you watch yourself to see how you look and, all of those things in your own environment and kind of looking and managing what are other people's body language. So they can be quite exhausting. So one thing that our organization has been really great in saying this whole time that we've been working remotely is, you don't work 8 hours a day at the office because you're chatting with people, you're, having conversations. Don't expect yourself to be sitting and working for 8 hours straight. You just can't do that. So we've been encouraging people to take walks, to do the things that they enjoy throughout the day. We've had some of our committees at our organization do our wellness every day at 10 a.m. They send out an email that has a video link to a yoga video or encouraging you to process and think about some question that they put out there, but every day at 10 o'clock. You just know it's coming. And so it's just a time to get up, stretch, move around, or, kind of have some critical thinking. They just kind of vary and change that up. And then we have an all staff connector that people can get into every Friday at 9:30 or 10. So we can kind of still see each other and engage when we're all working from home.
I like that. Just the concept of connecting with your staff, not just working on a project, but just connecting. And like you said, checking in can be very powerful. I know I've had a few very long Zoom days. I want to say my max is 7 hours in Zoom in one day. And I had to, quite frankly, it was kind of scary to admit it, but I had other stuff to do afterwards. And I just told my colleagues, like, I'm sorry, but I'm out of gas. I got to take a break. And just being open, honest, and transparent, they were like, oh, absolutely, Dave, 100%. I'll check in with you tomorrow. Mm-hmm. But I found myself not wanting to admit that. But we've got to. It's okay to say, I am gassed. I need to take a break. So don't be afraid to.
Yeah, absolutely. We have to be flexible with ourselves. We have to take care of ourselves. So finding those things that really bring you joy, that you enjoy, that are safe for you to do. So just really kind of thinking about all of those things, but definitely taking time every day to be able to do just a small bit for yourself for self-care.
Yes. And there was a quote that I shared the other day, and it was, see if I can remember this correctly. I've slept since then, so I probably forgot it. But it was small hinges swing big doors. And I think that relates to self-care as well. Small little changes can have a big impact when it comes to self-care. It doesn't have to be this grand, I'm working out for 2 hours every day or an hour every day, or I'm going for a 30-minute walk. Little things can really have a big impact.
Absolutely.
Yeah. As you can tell, I like to talk about self-care and personal development, but I'll kind of reel myself back in, get back on topic. So what are some other sort of tips or lessons learned that you'd like to share with our audience, whether it's getting coalition or community engagement, working virtually with your staff, or even self-care?
Yeah, so I think, first off, this is a really great opportunity to reflect on what what our plans are. What do we have for our strategic plans? What are we, how are we implementing in the community? And take this time, because a lot of us aren't being able to do those things in the physical community. So thinking about, are we reaching the target population in the right way? Or how can we flex and be able to kind of think about it differently? We've had here in Nebraska a lot of our coalition's work with youth is in schools. And so the last, 3 months of the school year, they weren't able to implement their programming. So, kind of thinking and taking the time to be like, are we reaching young people in the most comprehensive way if all of our programming had to stop because we can't meet physically? So thinking about that, is this the right evidence-based program, right? If you can't, work with a developer to kind of create or move things into a digital platform, are there other things that you can do outside of that or kind of supplement to those programs? So really kind of thinking and taking time to process that, I think is really important, since we have the opportunity to do that in a little quieter schedule. And then also, I think really thinking about holding true to best practices. A lot of the things that we do in person, and saying, in trainings, to say, if you need to step out for any reason, give me a thumbs up, and come back when you can. But how do you manage that in an online world? How do you know when you can see someone potentially struggling with a question or pondering that in these really tiny little boxes and videos? So kind of thinking about, how do you set up those, or can you set up a breakout room that has, in the new mental health first aid curriculum, they have virtual hallways that any participant can, pop out to. So how do you manage that? So just thinking about what, if you do videos, how do you have opportunities for feedback to people to submit questions, so they aren't just left with pondering things and they just kind of feel like they're just left in kind of the abyss. So making sure that we're having best practices and still being able to have people connect with their questions or their discussion and feedback.
This is amazing. You've got my wheels turning. You mentioned a virtual hallway.
Mm-hmm.
I'm working with a group of folks to plan a virtual event that was going to be a big in-person symposium. And we're trying to figure out, how can we still capture that in between session time, that bench outside of a presentation room where so much connection and collaboration goes on, and we don't want to lose it. But the virtual hallway, that's cool. I'm gonna ponder that a little bit more. I like it. It.
Yeah, I think it's going to be a very useful opportunity for people just to kind of step out, but not leave the meeting, but be able to just kind of take a minute, and then for the instructors to be able to engage with them when they're in there and just kind of check in. But yeah, I think that's something that we may just be able to implement across almost all of our meetings or other kinds of online engagement.
Yes, and actually we've got training coming up, virtual training this very week. And now I'm thinking, can I work that into? How will the presenters feel? I loved how you said creating space or a means for folks to get their questions answered, to be able to contact you. I feel, and this is just my own personal opinion, that I've seen folks put out great informational content like on social media. But then when it comes to following up any kind of questions or comments, or really maybe even direct messaging that person to reach out to answer instead of just replying a short, not very personal reply in a comment, like that is a great space to really create that connection and help address those questions. But it takes some intentionality to it, but it's very important. So I'm glad you brought that up too. That could be as simple though too as just saying, hey, here's our email address. or info@region6.com. We'd love to hear from you. I like it.
Yeah, so just offering it up. People may not use it, but
Mhm.
isn't as a mechanism for them to feel like they still can connect if they do have those questions. And
Mhm.
just to say, there's no dumb question. Send
Mhm.
anything that you need more information on, or you've got additional things you want to find out.
Mhm. I would tell people in trainings afterwards, like, email me. I hope my inbox is flooded with emails. And I was like, if it is, that's awesome. Because that, like I said, that's that many more people that I can help. Like,
Yeah, it's I just think that sometimes people feel like they would be overwhelmed with them, but
Mhm.
really, if you have more opportunity to really get the questions answered to the people,
Mhm.
rather than sitting and having them kind of just stew and
Mhm.
to become more challenged, not being able to
Mhm.
process through those.
Yes. Anything else you want to plug or highlight, or any great things going on in the Nebraska prevention field you want to shout out and say, hey, they're freaking awesome?
Everyone's awesome. I think we've got a really
Yeah.
great, we've got a
Yeah.
great state staff team. We've got fantastic staff in really all the different divisions
Mhm.
because, you've been working very closely with the Division of Behavioral Health, but we
Mhm.
also have the Division of Public Health that's very, becoming more and more connected through our prevention work, substance abuse prevention, through our opiates work and our tobacco prevention. So really, we've got some great um, working relationships at the state level, and all of my counterparts at the regions. We've all been in our roles probably for over 5 or 6 years now. So we have really great working relationships there, and to being able to support down to our communities. Many of our coalitions have been around for a long time. And so they're well rooted in their communities, continuous development of programs and things. So we've got a great system.
Well, then it has been an absolute delight. Thank you very much for taking time to chat with us today. And we should definitely have you back on for another episode.
Yeah, I'd love to come back. Yeah,
Yeah.
invite me anytime.
All right. Stay tuned and thank you again.
Yeah, thank you.
That concludes this episode. Thank you all for not only taking time to listen, but for your continued work making our community safe, healthy, and drug-free. If you'd like to know what trainings we have coming up, check out our website at pttcnetwork.org. There you can subscribe to our monthly newsletter and get the latest, greatest delivered right to your inbox each month. And remember, prevention is better together. And together, we are stronger. Thanks for listening, and we'll catch you on the next episode.